I would have to say the one thing that inspired me the most to become a nurse practitioner was through my career. I've been doing this for 30 plus years, and it was the patients that I found that just by educating them on some of their disease processes when they would come into the hospital setting, I could prevent them from returning by just a little bit of education. And I felt, well, if I can do that, maybe I needed to pursue and really make a difference. So I really focus on prevention and education as a big key tool. Ryan is a good friend of mine, and I had called her up saying I wanted to relocate back to the Wisconsin area, and she contacted me and said that they had a position upstairs as a hospitalist. So I started that role there and found that I liked it, but I missed family practice. I missed doing the education part and doing the preventative medicine that I think would keep them out of the hospital setting. Giving them I make my patients accountable. I want them to be accountable for their disease processes and their own health. And I was missing that from that perspective, and so I reached out and they happened to have a position open, so I was very pleased to be allowed to come and practice at Reedsburg Area Medical Center as a provider. I think the most rewarding is meeting the patients and their families and actually working with both of them. I don't want to just say this is your problem, it's a family. And my biggest happiness is when I get to take care of multiple family members. Basically from the lifespan, I get to take care of a grandchild and a grandmother, or the entire family. Anyway, that's one thing I enjoy, is taking care of a true family experience. A lot of those disease processes follow through the lifespan of families. So, say my mother has diabetes, well then chances are either myself or one of my children could have diabetes. So just educating them on that and knowing that I'm the one who's taking care of them and knowing what works best for that family. I enjoy that, and that's one thing I really truly enjoy, is being able to take care of an entire family, and then not only that, but birth through the lifespan. Seeing patients of all ages is very rewarding to me. That trust that you build with your patients is so important. They will tell you things that they may not have told a provider that approached them differently. Showing that you have compassion and love and care for them and truly do want to make a difference in their lives. You do want to help them through their disease processes, whatever they may be, whether they're an acute illness or a chronic illness. You're there for them. And I think that's really important. I love being with family. I love my family. I have grandkids that are in sports, and I'm everywhere. I have a daughter that lives in Plover, so she has 2 children that are in ice skating and soccer, and then I have grandkids in the Dells, and they are in basketball and football and wrestling, softball. So it's the whole thing. That's what I do. I love hiking. I love taking the kids to state parks. I'm an outside grandma. I want kids to be outside playing. I don't want them inside. I want them being active. And so I take the kids out and we do things together. So I have a golden retriever. Her and I enjoy going out for walks, hiking. She goes everywhere with me. We go on excursions. The grandkids all love her. And so she's definitely a social butterfly.